If you are experiencing any form of wrist pain or dysfunction, whether that be from RSI or like a previous injury or a break, please give this banded wrist capsule stretch a try. Because clinically, stiffness and tightness through the capsule of the wrist joint can play a meaningful role in people's wrist pain and dysfunction, but for some reason it's not spoken about or explored enough. Hello, my name's Grant Frost. I'm an Australian musculoskeletal physiotherapist who is really passionate about trying to understand the root causes of common aches, pains and injuries. And in this instance, I want to help you figure out whether your wrist capsule restrictions are feeding into your current wrist pain or dysfunction. And all you need for this is just one of these power bands. You can definitely use a regular TheraBand or TheraTubing as well. What I always urge people to do before trying any exercise is immediately go and do a movement or an activity that alerts you to how your wrist symptoms feel. That could be something as trying to do a gentle push-up or push yourself up off the ground. It can be certain movements or activities that let you know how your wrist feels currently. Once you've done this exercise, I want you to immediately recheck those exact same movements or activities so we can base this on results. Because if you do this and you feel your symptoms are genuinely better in some way straight away, then that may confirm that your wrist capsule might be stiffer and more restricted than it needs to be. And what I'd like you to do is, with the band that again is secured to something sturdy, I'd like you to take your hand, come over the top and then underneath so that the band is almost like a wristwatch, basically on the crease of where your wrist is. And from here, we want you to stretch out the band as far as you feel comfortable and place your wrist and your hand flat on the ground. Just start to shift your shoulders over the top of that hand. Please be gentle, be respectful, listen to what your body feels like it's telling you. Don't go any harder than you feel you need to. Be respectful and gentle, because all we're doing here is we want to try and take you to the end of your range. And what this is doing, the band pulling backwards, is trying to hook into those bones in your wrist and hand that should gently slide backwards as you bend over the top. It just encourages them to do that with a little bit more specificity. And if they're a little bit stiff, if the capsule around those bones are stiff, sometimes it sort of jams up a little bit and you don't get that freedom of motion that you deserve to have if all things are moving and functioning normally. But in this position, you've got some options. Once you've found the end of your range, we can lean our body weight over towards your little finger a little bit more. We can come back towards your thumb a little bit more, just to find which angle accesses the best tightness for you. And then once you've found exactly where you need to be, and for me, sort of here feels the nicest, we can get you to hang out here for 30 seconds to 2 minutes. But for something a little bit different, we can very gently try and oscillate in and out of that end range. Again, paying attention to how this feels for you, knowing that if you start quite stiff, it might take a little bit of time to really get that tissue to free up until you feel like you're really opening up the inside of that wrist. When you come out of that again and redo your exact same movements, we want to see if something has meaningfully changed. Just be aware that when you use a band on an area that might be a little bit sensitive, it may feel a little bit tender afterwards, but just be gentle, don't be brutal, at least the first few times you do that, just so you're not unnecessarily stirring something up. But base this on results. Do you feel genuinely looser and less symptomatic straight away after doing the banded wrist capsule stretch? Please let me know in the comments now. Because the interesting thing about this is that obviously if you have broken your wrist, broken your arm, and you're in the middle of your rehab program, this may be an invaluable thing for you to do to respectfully force that wrist to move better at some stage. But if you're someone that has RSI or some other hand, finger, wrist dysfunction that this still helps with, you may also need to pay attention to what your neck is doing. I have some videos on the channel which I'll link up here where clinically I find that if you develop some RSI or some overuse type issues in your wrist, it may actually be a consequence of what your neck is doing, especially down the base of your neck and the top of your upper back. So as always, I genuinely hope that was helpful and insightful. If it was, please leave a like on the video, subscribe to the channel and consider becoming a member if you want more content like this from me. I'm in the middle of trying to put one of these videos out each day just to give some helpful tips and tricks around various exercises that I turn to with my patients clinically. So if you want to be kept up to date with that, please follow along. But as always, thank you again for watching. I do genuinely hope that it was helpful and I hope to see you tomorrow.